Hey guys, Dr. Brad Bodel here with tip number 2 on 7 tips to help your Hashimoto's hypothyroidism. And the tip today is that you must have consistent and steady blood sugar to support not only your thyroid, but your entire system. Now, in tip number 1, we talked about if you have increased levels of inflammation, that is going to wreak havoc with your immune system and the way that your thyroid can work. Well, one of the things that can increase inflammation is changes in our blood sugar. Now, typically we see 2 different patterns of blood sugar changes. One being that our blood sugar is too high, and the other is that our blood sugar is too low. Now, to identify these things, we look at a couple different symptoms. For our blood sugar being too high, usually people are getting a little sleepy, a little tired, a little drowsy about 30 minutes after they eat. Now, this is something that needs to be remedied because it shows us that our physiology is off. And the way that we fix it is first by reducing the amount of carbohydrate, especially refined carbohydrates that are in our meals. If that doesn't help the problem, then you may have to reduce the size of your overall meal, reducing the protein and fat content as well, until you get to the point where you're not having those changes in symptoms following eating. On the other side of things, blood sugar being too low is often signified by not being able to deal with going without food for an extended period of time. So if you don't eat for 3 to 4 hours and you notice you're getting a little shaky, a little irritable, a little headachy, maybe even nauseous, this could be one of the big signs that says you're a bit too low on your overall blood sugar levels. So to fix this sort of a scenario, again, we're going to need to reduce our refined carbohydrates, but one of the big pieces is you are going to need to eat more protein and fat at a more regular basis. So sometimes early on, people are going to be needing to eat every 2 to 3 hours to avoid these blood sugar crashes and rehabilitate the system. So the tip today, tip number 2, is that it's important we have steady and consistent blood sugar levels to support our thyroid. And to do so, we have to identify the pattern and then apply the appropriate therapy for such. We hope this is useful to you guys. Let me know if you're experiencing some of the symptoms that we discussed. And as always, if you have any questions, feel free to comment below. Thanks you guys, and tip number 3 will be coming real soon.